Hey there, Todd Ure with the Pharmacy Podcast Network here at ThoughtSpot 2025. I'm here at the Outcomes booth with John Grice. I've never met you in person. This is so good to see you.
Yeah.
Welcome to ThoughtSpot.
Thanks, Todd. It's great to be here.
And it's so good to be part of the Outcomes team. If you said to me, we get to talk about technology, we get to talk about where our industry's going. We have a pharmacy owner, someone who understood operating a pharmacy, and now let's fuse that with the technology that's going to help our pharmacists and pharmacies transition from being dispense-based to now becoming paid for clinical treatment tracking services. Like, this is the place to be. I'm so excited to have you here. Please tell our listeners about yourself, because you were a pharmacy owner and you're a pharmacist.
Yeah, you bet. No, you said it well. We're at an interesting point in the world of pharmacy, and so I'm glad to be here talking about it myself. I'm a third-gen pharmacist, just kind of raised in the industry. Grandpa was a pharmacist, then my dad and uncle both became pharmacists. Gosh, after me, I've got two cousins and a little sister who are all pharmacists as well. So it's just kind of in the family.
In your blood.
Yep. And I was running the family company through the end of 23. We did retail, we did long-term care, specialty, infusion, you name it. We were doing it. Anything outside of the hospital was our mantra.
You must have always had a connection to technology, and otherwise you certainly wouldn't be, partnering up with Outcomes per se. But what was it about your systems back in the day? And now I'm starting to sound like an old guy, but I've been in pharmacy for 20 years, and just like you, your whole family. But talk to us about the transition from pharmacy ownership to now helping other pharmacy owners leverage technology.
Sure. Yeah, the evolution of things, right? I grew up underneath the bench while Dad was swapping floppy disks for new version releases back in the day. And so I've seen all sorts of different innovations in pharmacy. Really, ideally, it's around improve care and reduce the cost. And so at Hometown, we were focused on those same things. But what I've liked about Outcomes and the mission that we embarked on 3 years ago was around how do we take where pharmacy's at and do those two things, but do it in mass.
Mm-hmm.
Improve patient care and reduce the cost. And I think bringing together the three companies that our CEO had that vision to do was really key. Bringing together pharmacy management software with Outcomes and then throwing in the prescribed wellness piece to all of that is how we're going to be most efficient at filling scripts, but then helping our pharmacies, enabling them to really embrace the new clinical services, not just in addition to, but like at the same time. And so that was the vision that I caught from him. And I think our team is all motivated around that's the vision that we see pharmacy needing, and we're working hard to provide it.
That's awesome. So when I think of changing systems, changing processes, changing how we work, as our pharmacy technicians are now doing more to support our pharmacists in any setting. It's not just independent community pharmacy. And I think, okay, we've built these new systems, we've built these new programs, and how pharmacists are going to be doing more. That's great. We have to do that. But we need to be able to measure it. And we have to have insights that give us data so that we know, is it working? And what twerks do I need to make in my workflow, in my treatment programs, in how I'm following up with a client, with a patient? Talk to us about insights. Talk to us about the importance of data and what you guys are planning on rolling out and continuing to grow.
Sure. And the way you describe that, it's kind of two sides of the same coin. We've got to follow the dollar. I had a really intelligent pharmacist when I was really green tell me, just follow the dollar and you'll find your way. But
true.
We've also got to invest in the research, understanding our own business, really knowing what we're doing, why we're doing it, to know where's the dollar at, or maybe to illuminate different opportunities that we're not actually seeing yet. We're not truly doing the right things. We're just doing what has always been. And so our product pharmacy, RX Insights, or we just shortened it to Insights basically, but Outcomes Insights is a tool for basic business intelligence. Every PMS has its own reporting module. And then the savvier users will apply a BI tool on top of it. And there's a number of good ones at every trade show. Our Insights is a tool that does that same thing. Our vision with it, though, is to be able to make it so user-friendly that it doesn't have to take an hour or two that you invest in the office, sitting there running reports or trying to distill them down. You can get to the point where you know exactly what you want. Either it auto generates and sends to you, or maybe even it's as intuitive as ChatGPT that more and more pharmacists are just using in their personal life. They may be able to ask questions of an LLM like that and get the insights that they need. And we could really change the way we think about data and we think about our own pharmacies when we get to that stage.
So I was saying the need to develop new processes and how to use technology to get us where we need to go, doing a lot more hands-on and treatment tracking. Now we're talking about the reporting. Now we're talking about, hey, Insights is now going to give us, here's how things have progressed. Here's the revenue we're generating. Here's the gaps of what we can do. All right. Now I'm listening to you as a pharmacy owner. Even I might even be a user, right? And I'm thinking, is this something that I have to upgrade, or is it already integrated? Like, how would I get started in using Insights?
Well, right now, we have it available for any of our RX30 customers. Insights is just a free flip a switch, turn it on.
Okay.
So our users are already using it, but it's continuing to grow and expand already. And so, you know, if you're on RX30, just ask.
Okay.
We'll turn it on and teach you how to use it, and you can start playing around today.
So Insights is a really important tool to change management, and change management leads to better outcomes, literally.
Yeah.
But if you don't have a leadership map, if you don't have a leadership roadmap, if you don't have like a thought of like, how do I take my team, gather my teams, gather my clients, even gather people in my community, my nurses, physicians I'm working with, we have to be leaders to help this change management. So talk to us about how important it is. We can talk tech all day. We can nerd out. Of course, you and I could probably talk for hours and hours. It'd become like a Joe Rogan episode, but
it'd be fun.
It would be. But the important thing is that we're helping to guide our operators to having all the pieces of the puzzle. And you're going to have strengths in some, and you're going to have weaknesses in others. You're going to come back to the outcomes team to backfill a lot of that insight stuff and the data and stuff. But let's talk about leadership. Let's talk about how are we going to embrace every component of the people that I just talked about, so that ultimately our patients getting the best patient care and health care, but I'm also helping to transform my community.
You got it. So it starts with that research almost. As you look around the pharmacy space today, we see two major themes, right? Costs are going up. Everybody's complaining about the high cost of drugs. And at the same time, pharmacies are going out of business. We're seeing headlines, closures, all that good, bad stuff. How's that true? How are both things simultaneously true, that a market or an industry has inflated costs, way too expensive, and everybody that's doing that thing are going out of business? Well, clearly we have value misaligned. We have dollars flowing to places other than where the value is being created and delivered.
Right.
Well, how do you change that? You got to shine the light on what is the value, and then start orienting people's, basically their financial models around those metrics that matter. We've gotten a little off base. I'm not sure where to point the finger exactly, but I do believe that metric is still out there. We're just not playing Moneyball right now and finding it. And that's what Insights is going to be able to do. And that's what I think the whole industry needs. Everybody's going to resonate when we say, look, the pharmacists are providing value to the patients, but if they can't answer the phone because they're so understaffed and overworked, then there is no value being created. You can cut their reimbursement or cut the drug cost all you want. You're just making the problem worse. We've got to reverse that somehow, and not just in a pay them more. I hear a lot of well-intended cries for legislation and things like that drive to a minimum dispensing fee. I endorse some of that, but at the same time I go, is that the best? Is that the right solution overall to get the Moneyball metric that makes everybody happy? That gets the patient taken care of best, that's first and foremost, but keeps the pharmacies viable, keeps the drugs and the drug companies happy, and of course the payers then are going to be the ones responsible for making sure that the metrics are all working. So that's our goal. That's our vision, or the leadership that we're trying to provide to the industry. Is we're going to find it, and we're going to keep moving everybody towards that new metric, if that's what it is, or that mindset of that the current system has these problems. Let's find the new.
And the current system is broken. We're getting better. We're seeing things change. We're seeing pharmacists take leadership. We have two people in Congress that are pharmacists and pharmacy owners, Buddy Carter and Diane Harshberger.
Yep.
So representation of pharmacy in as leaders, as leadership, it's there. If you're a community pharmacy owner, you are a leader in your community. Your community trusts you. Therefore, take advantage of all of your operations. Take advantage of your computer systems and your packaging systems and your infrastructure. Bring in your Congress people. Bring in your state representative or your state senator. Reach out to them and say, hey, I want you to come in and do a tour at my pharmacy. I want to show you a report and give you insights into how our pharmacy specifically is saving X number of dollars because of what we're providing. And if we could use technology, even an insights report that could be built just for your, we'll call it the insights politician report, right? But we'll be able to show them, hey, this is the impact that we're having on this community. Therefore, it helps give them ammunition to go back and fight for their constituents and saying, here's how PBM reform could really revolutionize pharmacy care.
That's a great example. It's a great idea for how to actually accomplish that. It's also been the main goal of Outcomes from its beginning, right? Like, you're already providing this care, document it, and then get paid for it.
Yeah.
And so that's what we're trying to do with Outcomes, is make it easier to document the care you already provide, the best interactions that when those legislative visits happen. It's not a nice fancy report that gets plopped down for the good senator to look through. It's watching that pharmacist interact with their patient right over the top of the counter. Then whoever it is standing there is able to go, wow, look what just happened. Now what just happened? And they'll ask kind of a question or have a conversation about that patient smiled, walked out of here, maybe bought something, maybe didn't,
Right.
but is now going to be on a whole different path than they were just 10 minutes ago. And the pharmacist was the one that had that conversation that made it happen.
That we're doing multiple pieces of this, and what this leads us to is evidence-based outcomes. And it's literally that, because now you're taking every piece of what we're saying, your technology, your operations, sprinkling in your local community and politician, everything that you're going to need to really lead us to this next phase of pharmacy care and community pharmacy care. Community pharmacies are the future of keeping our nation healthy, because of the deserts that are popping up all over the place. So we have to have ways of filling in those gaps, and Outcomes is definitely a part of it. John, this has been amazing talking with you. Really appreciate this time with
you
you.
too. I appreciate it. Thank you.
All right. We're here at Outcomes booth 130.